The C-SPAN networks bring you long-form public affairs programming from the nation's capital and are a public service of your television provider. C-SPAN, created by cable.
To state here for the committee this morning.
Thank you so much, Chairman Hatch and Ranking Member Wyden, and to all the members of this committee for the opportunity to speak with you today and to engage in a discussion about the road ahead for our great nation. I want to thank Senator Johnny Isakson so much for his incredibly gracious introduction. As he mentioned, we've known each other for 30 years or so. I'm so grateful for his friendship and his kindness. Our state is so grateful for his leadership and his service, and we're blessed to have had it. I wish also to especially thank my wife, Betty, of 33 years, who joins me here today. Her support and her encouragement and her advice, which I will remind you is always correct, and her love that she has given me over those past 33 years I'm more grateful for that than I could ever say. Over the past couple of weeks and months, I've met with many of you individually and gained a real appreciation for the passion that you all have for the critical work that's done at the Department of Health and Human Services. Please know that I share that passion, which is why I'm here today and why I'm honored to have been nominated to serve as the next Secretary of Health and Human Services. We all come to public service in our own unique ways that inform who we are and why we serve. My first professional calling was to care for patients. That experience as a physician and later as a legislator has provided me a holistic view of the complex interactions that take place every single day across our communities. And today I hope to share with you how my experience has helped shape my understanding of and appreciation for the Department of Health and Human Services. From an early age, I had an interest in medicine. My earliest memories, though, were of growing up on a farm in Michigan, where I lived until I was 5 years old when our family moved to suburban Detroit. I spent most of my formative years being raised by a single mom. Some of my fondest memories as a child were those spent with my grandfather, who was a physician, and I would occasionally spend some weekends with him, and he would make rounds, which meant that we got in a car and went to people's homes and made house calls. And I'll never forget the warmth and the love with which he was greeted at every single door. Those impressions are seared in my memory. After graduating from medical school from the University of Michigan, I moved to Atlanta, which I've called home for nearly 40 years. It's where I met my wife, Betty. It's where we raised our son. I did my residency at Emory University and Grady Memorial Hospital, where I would later return in my career to serve as the medical director of the orthopedic clinic. Throughout my professional career, I cared for and treated patients from all walks of life, including many, many children. And anyone who has ever had the privilege of treating a child knows how fulfilling it is to look into the eyes of a mom or a dad and say how we helped heal their son or their daughter. My memories of Grady are filled with the gracious comments of parents and of patients for the team of healthcare specialists with whom I had the privilege of working. After 25 years of school and training, I started a solo orthopedic practice. Over the years, this practice grew, as Senator Isakson mentioned, and eventually became one of the largest non-academic group practices of orthopedics in the country, for which I eventually served as chairman of the board. During 20 years as a practicing physician, I learned a good bit about not just treating patients, but about the broader healthcare system and where it intersects with government. A couple vivid memories stand out. One are the number of times where patients were remarkably angry about the individuals figuratively, not literally, but figuratively, standing between themselves and their physician in the clinic room, making it so that what the physician was recommending may or may not be possible, whether it was from insurance or regulators or government or the like. And then there was the day that I remember vividly that I realized there were more people in the office behind the door where we saw patients in the front clinic area trying to fight with insurance and regulators and government than there were in front of the door actually caring and treating patients. And it became clear to me that our healthcare system was losing focus on its number one priority, and that is the patient. As a result, I felt compelled to broaden my role in public service and help solve the issues harming the delivery of medicine, and so I ran for the Georgia State Senate. I found Georgia's State Senate to oftentimes be a remarkably bipartisan place where collegial relationships were the norm. This is the environment in which I learned to legislate, reaching across the aisle to get work done. In Congress, I've been fortunate to have been part of a collaboration that broke through party lines as well to solve problems. Just this past Congress, as you'll recall, It was a bipartisan effort that succeeded in ridding Medicare of a broken physician payment system, and which has now begun the creation of a system that, if implemented properly, will help ensure that seniors have access to higher quality care. If confirmed, my obligation will be to carry to the Department of Health and Human Services both an appreciation for the bipartisan, team-driven policymaking and what has been a lifetime of commitment to improving the health and well-being of the American people. The commitment extends to what I call the 6 principles of health care: affordability, accessibility, quality, responsiveness, innovation, and choices. But Health and Human Services is more than health care. There are real heroes at this department doing incredible work to keep our food safe, to develop drugs and treatment options driven by scientists conducting truly remarkable research. There are heroes among the talented, dedicated men and women working to provide critical social services, helping families, and particularly children, have a higher quality of living and the opportunity to rise up and achieve their American dream. The role of the Health and Human Services Department in improving lives means it must carry out its responsibilities with compassion. It also must be efficient and effective and accountable, as well as willing to partner with those in our communities already doing remarkable work. Across the spectrum of issues and services this department handles, there endures a promise that has been made to the American people, and we must strengthen our resolve to keep the promises our society has made to senior citizens and to those most in need of care and support. That means saving and strengthening and securing Medicare for today's beneficiaries and future generations. It means ensuring that our nation's Medicaid population has access to quality care. It means maintaining and expanding America's leading role in medical innovation and in the treatment and eradication of disease. So I share your passion for these issues, having spent my life in service to them. And yet there's no doubt that we don't all share the same point of view when it comes to addressing each and every one of these issues. Our approaches to policies may differ, but there's surely there exists a common commitment to public service and compassion for those that we serve. We all hope to improve the lives of the American people, to help heal individuals and whole communities. So with a healthy dose of humility and an appreciation for the scope of the challenges before us, with your assistance and with God's will, we can make it happen. And I look forward to working with you to do just that. Mr. Chairman, I thank you for the opportunity to be with you today.
Well, thank you, Dr. Price. I can't think of